National data and clinical evidence shows that particularly for elderly patients, those over the age of 80, for every 10 days they spend in hospital is equivalent to 10 years of muscle wastage. And for somebody coming to the end of their life, that's a significant amount of deterioration, and it can be the difference between those patients going home independently or going home with lots of support that they otherwise didn't have before they came into hospital.
I desperately want to get home. I want to be with my husband again.
Red Green is a way of working. It's about how we do things here, and basically what that means is all the teams who are involved in helping care for patients as they stay with us in the hospital can come together and say a red day is a day where something should be happening but isn't happening. A green day, however, is when something productive is happening to those patients to help them get better and help them move towards going home.
Coming a little bit further back there.
So the national picture is that we have an ageing population and a growing population, and that's the outcome of some wonderful NHS treatment over many decades. But it means that more and more people are needing hospital care, and that puts pressure on our system. And what we want to do is make sure that for every day people are in hospital, that's a really useful day.
Hello, Maria speaking. Red and green to me means that we are actually promoting a patient's journey by doing something for them towards their discharge every day. My side of it is I usually do all the phone calls to adult services or enhanced recovery, making sure that the social workers are kept on form.
We'll get started, shall we?
Inpatient stays is now more than ever the business of a multidisciplinary team. There's the doctors doing their thing, there's nurses both caring but also thinking about people's care needs on into the future, and then a wide variety of people in other therapies, physiotherapists, occupational therapists and others, and then of course a really crucial link with social care and then community services outside the hospital. So this is a much more difficult business, looking after people who come into hospital now than simply just making them better and sending them home again.
What more do you think you need to be able to do to get home?
The principles are that of coordinated, effective, timely care, and it's a good process about how to manage patients with many people involved.
We want to encourage patients to be part of their care plan and to understand what's going on in terms of what's happening to them. So we've got the initiative around the placemats that really ask patients to ask some fundamental questions so that they're aware of what's happening to them and they feel party to those plans.
What is wrong with me? What are you considering? Everything's been explained to me very clearly. It takes away the worry.
I was quite dubious to start with, thinking it was another fad, be around for 6 months and it'll be gone, so get through it. But once you've cottoned on to the idea, it becomes more vital because you can see everyone can get their tasks in the morning in the huddle and you know that you are going to move that patient forward, and that's quite satisfying. Particularly at the beginning, we were feeling quite low because we weren't getting to green days, but we've progressed from that, and identifying the task becomes the relief rather than the disappointment of not making a green day.
There understandably is scepticism about things that we introduce because we have a number of initiatives across all of our organisation and across the whole of the NHS. I think what's different about this one is that it's easy to use. Our staff find that it's a really helpful tool to help them identify where they need to focus their efforts. It makes it easier for our staff, and what it does is it makes it better for our patients.
Okay, so she's a green day.
She's a green day.
She is a green day.
Green day.
Perfect.
If we're identifying that a patient is being persistently stuck on a red day for a certain reason, there is now a much clearer route for us to be able to escalate between a ward level and senior management level within the hospital. As a team, we're now more structured in our decision making. Everyone's got a voice and it's really welcome to contribute and have a role in the discharge process.
A shot, standing, the balance.
On a daily basis, what it means to me is that we look at what the patient needs and we discuss it as a team, and everyone has a responsibility to work with whatever it is, whether it's an assessment, whether it's a CT, whether it's drugs, that we all have a responsibility to ensure that we make that patient green that day if at all possible.
The concept of end PJ paralysis is just about getting people up and moving and just getting them sort of really to get into their rehab a bit more and not just be sort of sat in a chair thinking what am I going to be doing next, just sort of to really get them moving.
Long way.
It does, doesn't it, when you're walking?
One of the things I really love about these schemes is they really encourage teamwork, both within our own clinical teams in the hospital, bringing people together around the patient in a very multidisciplinary way, but also with our partners outside of the hospital, so working with community health providers, with social care and with families to help support people to get home as quickly as possible.
Well, their discharge will be planned for tomorrow, so they'd have their medication, they'd have their transport booked.
So TTO's transport's been done.
Yep.
Lovely.
Partnership is really crucial as the community liaison teams sit together with the acute staff to identify patients that are appropriate for community care.
So really it's all working together so that we can then, when the patient is well enough to go home, that we get that at the right time so the patient is not in hospital for any longer than they need to be, and then we can assess them at home.
Traditionally we would complete assessments in an inpatient environment, so nursing, therapy and social work. What we're now doing is doing those in the patient's own home where they're much more likely to succeed. This then gives an accurate picture of what that patient's longer term care needs are.
So Red Green is a national initiative, but what's been really special about the way we've rolled it out here at Hampshire Hospitals is that the teams have made it their own. They've put forward how things should work on their ward, how things could be improved, and that way we're really making it a Hampshire Hospitals way of doing things.
What it means to me is that we look at what the patient needs and we discuss it as a team.
Everyone is actually involved.
We're getting more green days because I feel I'm challenging myself more.
So far we're finding really positive impact.
Making the patients and the families understand that home is the best place for them to be cared for.
Our patients are more focused about why they're in hospital and what's keeping them in hospital and the steps that they need to go through in order to be able to get home.
It certainly seems to be the right way forward.
It works, and will we continue working like this? Yes.
So the aim is to take the experience that we've gained on the exemplar wards and roll Red Green out across the whole of the hospitals. And my plea really is to you to think about how you can play your part in making sure that Red Green happens and we are as effective and efficient as we possibly can be, so that we can provide the best possible care to our patients.
I'm so lucky. I'm getting better, and he said I'll be going home.